Okay, hi, this is Miss Steph, and I'm just going to try and show you flossing on my mouth because you have um, expressed a desire to get better at it doing on yourself. So I would take 12 to 18 inches here. And I'm just going to show you on me kind of some of the wrist action that some of you are struggling with. So I'm going to start with one end here, right? And then here's the 12 inches, so I'm going to just wrap maybe once or twice around this middle finger here, then I'm going to tuck that down out of the way. Same thing now, I'm going to come in with this hand and just come around once. So how we'll do this is you're going to continue to feed down the 12 to 8 inches this way. So one middle finger will be winding while the other one just kind of allowing it to just like, it's creating tension here, but it's just one wrap like that. So, okay, so I'm going to start here. I'm just going to show you flossing on me. A lot of you were expressing some concern about how to guide the thumb and index fingers, and a lot of you are wanting to guide with the middle. Okay, so you don't want to guide with the middle. Those need to be tucked, keep it nice and taut and out of the way. Then you're going to do your guiding either with thumbs or index fingers like that, right? So here on me, I'm going to just kind of retract my lips and kind of show you. Okay, so I'm going to go like this. And you see that I've got just my thumb on one hand here, my left hand, and my index on the other. Okay? Up. All right, that. Okay, and then you see what I did with my wrist there? Here, and then like that to the other side. Okay, and I'm just going to show you a few teeth. Now see what I did there? I used my thumb here, and then index finger there. So you see how you're using them in concert. Sometimes it's thumb and index finger here, or thumb and index finger here, here. But you want to just kind of allow the floss to go where it feels most comfortable. So you don't want to be crossing your wrists or doing weird things like this, where you see how my wrists are crossed. Your wrists should always be aside from each other. So if I'm flossing, you look like I'm on the left, okay? So this hand would be on the inside, and this would be on the out. So you wouldn't want to cross like this. So let me show you again. I'm going to keep going a little further back. Here. There. So you see how you use index here, and then thumb there. Okay? Thumb, index, thumb, index, right? So you see I'm getting my breakfast out there. Gross. Okay? So I'm just going to floss a few more teeth so you can kind of see the pattern of these digits work in concert with each other. A lot of times you're not using all four at the same time, but look where my middle fingers are. This whole time they've always been tucked down here. And I'm just winding up and threading with the other, okay? So I'm going to show you here. Now remember, I said too, if you're going to go back to the back, you want to close a little bit. See when I open wide, tight, and I close a little bit, looser. Okay, so when I go, oh, I got food there again. When I go to the back, very terminal tooth of the arch, I'm going to close down a little bit. and come around the back. All right, and sorry we went into screensaver mode there for a second. Okay, so same thing on the upper back. Close a little bit, and you see how I just used my index back there. And my thumbs are out of the way because you can't get all 4 digits back there. Okay? So that's it. And I mean, I could show you really quick without talking, without commentary, how quickly you can get with this. Okay, so that's already a quad. The other thing I would say is as you're doing the outside versus the inside, that typically most of your movement is with the outside hand. Whereas the inside, whichever hand is on the inside, is more stationary, and more of the movement of the floss, right and left movements, is on the outside hand, whereas the more stable one is on the inside. Now here, as I cross the midline, I'm switching hands. One's on the outside, one's on the in. And that's the very back. So you see how when I go forward, I'm using my thumb on this outside hand. And when I'm moving in the backward direction, I'm using the index. So practice makes perfect, and you're not going to get it the first time. So just keep working at it.